Hello, everyone. We're back again, continuing the series for the synopsis for the full course clinical examination for OSCE. I'm not using my glasses today because I'd stepped on them. I need to use my glasses because if I'm photosensitive and I find it difficult to deal with computer glares, but I think I'll manage. So we'll be talking about the parotid gland, which is the salivary gland, the largest one. Now, like the other examination, we will deal with that using wiper to start with. And we've talked about wiper in our previous video, but I'm going to give us a reminder here. Wiper is wash your hands or using water or the sanitizer anyway. I would make a video on the proper steps of hand washing down the line. And so the next is to introduce yourself, permission, position, exposure, and reposition. Now, once you've done that, remember the IPPA, inspection, palpation, percussion, and auscultation. Like I said, you don't need all of those in every examination. So for the examination of the parotid gland, the very first thing you want to do is inspect quickly the region. So it's in the temporal region, isn't it? And remember, it's a bilateral organ, so you need to inspect right and left and compare. Once you've done that, quickly you need to palpate. And also with this gland, it has got a superficial and deep part, and therefore you're going to palpate externally and internally, like most things in the mouth. Remember in the mouth video, we said you palpate externally and you palpate internally. So one way to easily remember the steps is SOD, that's SOD. So you have the superficial gland, you do the oral palpation, and you do the deep gland. And generally, one of the things to remember when you are palpating the lump is the nursery rhyme called "Should the children ever find lumps readily?" And so the first word there, should, stands for think of size, sight, shape, surface, skin, changes, scars, and symmetry. What I tend to call the 6S. So that's size, sight, shape, surface, skin, and symmetry. And then V is temperature, tenderness, transillumination if it does apply. Probably transillumination doesn't apply, but temperature and tenderness applies to the examination of the parotid gland, because some of the causes of parotid gland abnormalities could be inflammatory, could be cancer, there could be an abscess there, it could be trauma as well. Then children is color, consistency, and compression. The color is important because you can tell, especially for patients that are quite fair-skinned, you could tell the difference. You can look for things like redness and things like that. Consistency is trying to decide whether it's solid, is contains liquid, or a few times maybe gas, but it wouldn't apply. So one old clinical skills way to determine that is this: what feels like your hand on your forehead is hard, what feels like the tip of your nose is firm, what feels like your lips is soft. At least that's what I was taught as a medical student, and I think is correct because all of the professors taught me that. The next is you think about the edge. So the edge is the side of the swelling. It's very useful in differentiating benign from malignant swellings. Benign swellings would usually have a smooth edge, preserved, because the benign swellings wouldn't ordinarily go to surrounding tissues. Expansion and pulsation. So in a few, not in the parotid, you could have pulsation when, for instance, the mass is adjacent or part of a vessel, common in aneurysms. And then you want to assess fluctuation to see whether it's fluid filled, typically in things like hydrocele in the testes. And always remember lymph nodes. regional lymph nodes are very important because they would tell you if the lymph nodes are involved, most importantly in cancer. Now, then finally, relations to underlying surrounding structures. You want to tell how it relates to surrounding structures, very important. So quickly, so you want to also, when you are inspecting / palpating, look at the facial nerve, because the facial nerve divides the parotid gland into the superficial and deep part, and it has 5 branches. Remember, you would have seen this somewhere. It has 5 branches. You have the temporal, you have the zygomatic, you have the buccal, you have the mandibular, and then you have the final one, the cervical. So it divides the gland into superficial and deep. So you want to do that. So once you've palpated the superficial part of the gland, you want to do an oral exam. Remember, similar to what you would do in the mouth exam, you want to palpate the deep part of the gland. I wouldn't talk about the technique because there are a lot of very good YouTube videos on other channels that deals with this, in live patients, in simulated mannequin type, and all types of way. Then you want to assess the facial nerve, all of its branches from head here, the tip to that. And then, of course, lymph nodes. That would generally conclude what is required in the parotid exam. At the end of the exam, in an OSCE, you probably want to be able to summarize your findings. One of the best ways to do that is using SBA, which is situation, which is the context with which why the patient came for the exam. Background would be any important clinical history in the case note. Assessment is your logical assessment that you can conclude from your examination. And then recommendation would be what you want to do next based on all of this. Then eventually you want to thank the patient. You want to thank the patient before you summarize. You want to thank the patient in a very respectful way, then summarize using SPA. Thank you for watching the video. A quick recap at this point is, in a parotid exam, you want to use wiper, you want to inspect, you want to palpate. SOD, you want to remember the nursery rhyme, should the children ever find lumps readily, and walk through that. You want to also assess the facial nerve and lymph nodes, and you want to thank the patient. You want to also report your findings using SBAR. Thank you for watching.